Now we're going to talk about the peak flow meter. This is a very important tool that's used to help you monitor how your lungs are doing when you're having an attack and when you're not having an attack. So let's learn how to use the peak flow meter. So when you're feeling good, to establish a baseline pulmonary function rate, in a standing position, you'll take a deep breath and place your mouth around the mouthpiece of this device. Take a deep breath, then breathe out and blow until you feel you have emptied your lungs, just like blowing out the candles on your birthday cake. Repeat it again on another good day to compare as baselines. Keep these baseline numbers for emergency comparison needs. When in an asthmatic crisis, you use the peak meter value during the crisis and you compare it to your baseline value. Make sure to include your baseline numbers on your action plans and report this data to your primary MD. Know what numbers related to your peak flow meter, know what numbers that when they happen that you need to seek emergency medical help. So know your numbers. And now we've got a time to plan. We've got asthma treatment and health promotion effectiveness. We're going to talk about putting your plan into action. Self-monitoring. Use of a written asthma action plan, including instructions for daily management and recognition of worsening conditions. You need to keep a daily diary to monitor and communicate your effectiveness of your action plan with your medical professional. So when you go to your doctor, your primary care physician, he needs to give you an action plan that tells you what to do when your peak flow meter numbers are worse. You're going to have a baseline, and then on the days you're not doing well, you can look at those numbers and compare them and decide what medications you need. You need this list of actions to take at home to monitor your medications and adjustment based on the symptoms of your peak inspiratory flow. Your measurements are as appropriate. Know and list what symptoms, your peak flow values that require emergency medical treatment, which have a list of what meds are used in an emergency. You need to know that if you're having a true asthma episode, the before baseline normal peak flow number value, and you take the number during your attack and you compare them. If there is a difference, you need to contact your medical doctor and let him know what your numbers are and seek help. Peak flow baseline numbers compared to peak flow numbers during an episode will give your doctor an idea about how many medications and what medications are needed to treat you. The comparison of the peak flow values help medication professionals determine possible medical actions that are needed. They can also help you and the doctor determine if you need emergency care. If you're feeling short of breath and you're having difficulty breathing, you could be having an anxiety or panic attack. You will know this is happening when you take your baseline peak flow number and compare it to your crisis number when you're short of breath, and they both remain the same. That means your airway is doing what it needs to do. Your air exchange is good. So during a panic attack, again, those peak flow numbers won't change. If you continue to have this problem of feeling like you can't breathe and you find out it's not asthma related, you need to report these numbers to your doctor and tell him what's happening, because rescue inhalers and asthma medications will not help during a panic attack. They actually need to give you another type of medication to help with anxiety and panic attacks. You need to develop your action plan with a medical professional and give a copy of this to your school nurse or to someone at school, especially if you're in sports. Thank you for listening. This is the end of my video. I'll be here for a while. We have peak flow meters at the front. You can come up and ask me questions. and I'll be glad to help you with any education on asthma. And thank you for having me.
Hello, my name's Glenda.